The femur, also called as thigh bone, is the longest, heaviest, and strongest bone in human body. It runs from hip to knee and divides into three parts: proximal end, distal end, and shaft. Proximal end consists of head, neck, lesser trochanter, and greater trochanter. Distal end consists of condyles and epicondyles, and the middle portion is called as shaft. The head of shaft articulates with the acetabulum of pelvis to form a hip joint. It has a smooth surface covered with articular cartilage except for a small depression called as fovea where ligament attach. The neck connects head of the femur and shaft. The angle between neck and shaft is called as inclination angle, and it is about 128 degree in an average adult. The greater trochanter and lesser trochanter are bony protrusions at the junction of neck and shaft. Greater trochanter provides site of attachment for many muscles of gluteal region, and lesser trochanter provide attachment site for iliopsoas tendon. The greater and lesser trochanter are connected by intertrochanteric line anteriorly and intertrochanteric crest posteriorly. The shaft, also known as diaphysis, is a long, straight part of the thigh bone. It is broad in upper and lower part and narrow in the middle. On the posterior surface of femoral shaft, there are rough ridges of bone called as linea aspera, which is a major site of attachment for many muscles in thigh bone. Superiorly, linea aspera diverge and forms pectineal line, which gives attachment to pectineal muscle, and it also forms the gluteal tuberosity, which provides attachment to gluteal maximus muscle. Inferiorly, the linea aspera divide into medial and lateral supracondyle line, which leads to medial and lateral femoral condyles. In between the medial and lateral supracondyle line, there is a triangular outline called as popliteal surface. The condyles are separated posteriorly by an intercondyle fossa but merges anteriorly, forming a shallow depression called as patellar surface, which articulate with patella. The bony projection on this condyle is called as lateral and medial epicondyle. This epicondyle provide attachment for the ligament of knee joint.